Hi, hi, welcome to a quick video about fruiting bodies. What are fruiting bodies? Well, they are structures that you will occasionally see when you see aspergillus in tissue or cytology specimens. And what fruiting bodies do is that they produce spores, and the spores are the form of the organism that are infective. So those are the form of the organism that we inhale. So in this picture, you see the septate hyphae in that rectangle on the left hand side, and these are septate hyphae of aspergillus. In the black circle is a fruiting body. So there's that kind of balloon like structure, and off the head of it are coming some vertical stick like structures, and on the top of those sticks are the spores, the round spores. In the red circle, you can see the detached spores that have come off of the fruiting body. So the fruiting body is also known as a conidiophore. Conidia is the name for spores, and conidiophore means a structure that bears conidia. So fruiting body, fruiting head, conidiophore, or conidial head are all synonymous terms. So this is what we talked about. In histology, if you see fruiting bodies, this indicates that the fungus is aspergillus. If you don't see fruiting bodies, septate hyphae with narrow angle branching are usually still aspergillus, especially in the lung, but can be other things. So could be scedosporium, used to be called pseudaliscaria, or also fusarium or some other fungi. So just having this kind of septate hyphae and acute angle branching is not pathognomonic of aspergillus. But when you do have fruiting bodies, it gets very, very close to being pathognomonic of aspergillus. That's why it's important to recognize these fruiting bodies if you ever see them. Microbiologists take it one step further. They use the morphology of fruiting bodies to speciate aspergillus into Aspergillus niger, Aspergillus fumigatus, etc., depending on how um, the spores are arranged on the head, how much of the head they cover, and so forth. So this is a sort of diagrammatic representation of what I talked about. So you have these septate fungal hyphae. So one hypha is seen at the bottom of the picture, and then you see a tube sort of coming off of it. That's the fruiting body, and then the dilated end of the tube, and then there are chains of attached spores. So that dilated tube is called the vesicle of the fruiting body, and then the chains of the attached spores and the detached spores, and then my very crude drawing of somebody inhaling the, the spores into their lungs. And that's how you get infected with aspergillus. By the way, mushrooms are a kind of fruiting body. The mushroom is actually a fruiting body of a fungus. You may or may not have known that. So just to summarize what we learned, the structure that bears the spores is called a fruiting head or fruiting body or conidiophore or a conidial head. The asexual spores are known as conidia or propagules or just spores. They are the infective forms of a fungus that detach and disperse. That's the stuff that you don't want to inhale. And finally, the name aspergillus comes from the fact that its fruiting body is shaped like a holy water sprinkler, used to be known as an aspergillum. This name was given to the organism by Micheli, I hope I'm pronouncing that right, in 1729. Thank you for your attention. Bye.